My name is Eunice N Ndung'U. I work with UNICEF Kenya Country Office. I'm a health officer supporting the Community Health Services Program. We work both at national level and at county level, supporting various components of the implementation of community health services. What I would say is that for us, it's not either or, because support to community health services is not an option, given that for any partner or any stakeholders who is working within the health sector and looking at strengthening health service delivery, and given that the ministry has already defined community level service as one of the tiers of care, then it's not an option of whether to support community health or not. But in addition to that, as UNICEF, our organization is about child's rights. So we endeavor to see that every child is born healthy, every child survives, every child thrives and develops to reach their full potential. For that to happen, it means that we need to ensure that the child is supported at the different levels to reach that level. The mother is also supported to be able to give birth to a healthy child. And we know that in Kenya, why many children are not surviving is because of basic causes, things that are predictable, things that are preventable. So to be able to prevent many of the deaths that are occurring for the under fives, for the mothers also, we are implementing community health services to implement community level high impact interventions for the mother, the newborn and the child. Secondly, we look at continuum of care, because if we strengthen health facility service delivery and we leave out the community level service delivery, then it means there is going to be a gap in service delivery. So for us to achieve continuum of care, we see the community level as one of our critical components in supporting the service delivery in community, in health services like we are doing. Another reason is that we have disparities in access of healthcare services in Kenya. So you find, especially in the arid areas, people travel over 50 kilometers to reach a health facility. So in order to bridge that gap of access to health facilities, community health services is a strategy that helps us be able to reach people at the household level, especially where there is poor access to health service delivery, the static health facilities. So that is where our focus is also mainly in the arid areas, where you find those regions are marginalized in terms of implementation of the static health facilities. So we are implementing community health as one of the stopgap measures. The other reason is that we see communities as partners in the provision of health care. And we appreciate that they are also duty bearers. If the child is to survive, then the community has to participate in a meaningful way. So we look at engaging community in a meaningful way to empower them to take charge of their own health. So those are the four main reasons why, as UNICEF, we are supporting the investment in community health services. I think we've come from far. If we look back and look at where we were in 2008, we've made great milestones in terms of harmonization of the approach that we use to implement community health. In 2008, if you were around, what was happening is that we were having partners implementing community health in different ways, having different types of volunteers at the community level, having different models. But right now, we have a very harmonized way of implementation of community health. We are also having a coordinated approach in terms of national level, how we are supporting the ministry, coming together as stakeholders and supporting the ministry together to be able to enhance the implementation as it should. We've also seen scale up of the strategy. In 2008, I think we were less than 5% in terms of coverage of community health units. Right now, we are over 40%. Then we had less than 1% implementation in the northern Kenya regions. We didn't have community health units, for example, in Turkana. We didn't have any in Wajir. And we've seen gradual scale up in those areas. So that is a big milestone, because we are seeing more and more stakeholders going to the northern areas where we are saying there is very poor access of the health facilities. And that is a big gain for us and a big achievement. In terms of policy, we've seen development of many guidelines and training materials that have helped in the harmonization. So training materials for community health workers, training materials for community health committees, training materials for community health extension workers, having a scheme of service for community health personnel, because that is a gap in terms of looking at the human resources for health at the community level. We now have a scheme of service that is already signed off and ready for implementation. Having the strategy also being reviewed is one of the other milestones, and even the agreement with the partners that we need a policy for this country. So that is among the other milestones that we've been able to convince everyone in the health sector that we need a policy to guide community health implementation in this country. So those are among the few milestones we've gained at the policy level and also in terms of implementation of community health. One of the lessons is that there's need of a lot of dialogue and negotiation for you to be able to get the buy-in of everyone. Because we've had to do a lot of advocacy, even among the partners, for them to see the need to invest in community health and to invest in a harmonized way. So the bit about advocacy and making a case for community health, because many were asking, are we going to get returns? And many are looking at getting immediate returns, like someone comes to the health facility, they get treated and they go back to home healed. But in terms of community health, it's about behavior change, it's about demand creation, it's about preventive work. The gains may not be seen today, like some people are looking at seeing. It's a long-term investment, and getting to that level of advocacy and telling people, you know what, invest in community health, but don't expect to see the gains tomorrow. It is gradual. It's about behavior change. It's about demand creation. It's about changing communities and helping them seeing themselves as a partner and as a stakeholder in the healthcare service delivery and the health outcomes that we expect in the communities. So it has been a process. My recommendation is that we are glad that Tier 1 has been defined as one of the levels of care in community, in the health service, in the health sector. So that is a plus. What we would ask is continued and sustained support to community health services. Because if we are to strengthen and if we are to reach and achieve the health indicators and the targets that we've set, it has to start at the community level. We have to invest at the community level in terms of the capacity of the health personnel at that level, in terms of the numbers, because we need more people, especially the trained health workers, who we call the community health extension workers. We need more support to get more recruitment at that level, and this is a plea especially to the county governments, because health has been devolved, and it is the mandate of the county governments to recruit. It's a plea we are making that they recruit more of the community health extension workers because of the critical role that they are playing at that level. We also ask for the support in terms of the commodities and the supplies that they need, because we appreciate that, yes, they do a lot of preventive services, but they need basic supplies. Just having a mark tape, for example, a mid-upper circumference tape to be able to do nutrition assessment is very critical. Just having a weighing scale so that they are able to, if they have a newborn, they are able to weigh the newborn and record as they should. Just having basic information and education materials as part of the kit that they need. That is very basic, but very critical in terms of provision of the services at that level. So we would ask for sustained investment in this service, in terms of personnel, in terms of capacity of the personnel at that level, and in terms of commodities and the supplies that they need. Community health services is here to stay. And as even we see the country developing more and more, we are seeing the challenge now transforming into not the communicable diseases, but the non-communicable diseases. community health services is one of the approach that would really help in terms of behavior change communication, because we know most of the non-communicable diseases are caused from health style issues which can be dealt with at that level. And also in terms of those that are already affected, the monitoring that is required can be very easily done at the community level. So what I would say is that I see community health services here to stay, because it's part of our health sector service delivery, and it's one of the critical levels that if we fully invest in, then we are able to achieve the health outcomes we all endeavor to achieve, and we are able to reach our goals as a nation.
Afya yetu, afya yetu, afya yetu, afya yetu, afya yetu, jukumu letu.